Hi, everyone. So this is the continuation of our conversation on the opioid epidemic. And here we're going to consider the impact that the COVID-19 pandemic has had on the opioid epidemic. And so we kind of have overlapping major crises that are occurring here. So to start us off, I want to look at, if I can advance my slides. Sorry about that. All right, now starting us off, let me move that over too. So here is a look at drug overdose deaths over the last 40 years approximately. And the majority of these deaths are going to be related to opioid use, not all, but the vast majority. And I like this graph to start us off with. We had this conversation in the previous lecture, but this graph shows us a couple different things. It compares it to the peak of car crash deaths, the peak of HIV deaths, and then something that we saw earlier this semester with firearm deaths. With that peak occurring, more recently. So it gives us a nice context to put in how many deaths are occurring per year from overdoses with some of these other, key features. The other thing I want to point out is that right at the very top there, we see that we had a peak and then a decline, right? So this is pre-pandemic. So pre-pandemic, we saw this huge spike in drug overdose deaths that's been occurring during the epidemic, fueled by opioids, and then started to make some progress, right? Starts to level out and flatten out there. And so folks were excited about that, right? That this was actually getting under control. And then COVID happens. All right. So a lot of this information is from the CDC as well as the New York Times. There's a nice article. I've linked them both on our course Moodle site. But what has recently been published is that the highest death toll now from the entire opioid epidemic has happened in the last year. So there's been a 29% increase in deaths, which is a huge increase over the previous 1 year period that ran from October 2019 to September 2020. So it covered the COVID pandemic in large part. One of the major issues is that this has been lost in the news cycle with COVID-19. We've been dealing with, an order of magnitude by 10 higher, right, with COVID-19 deaths. So we've seen severe death with that disease, but the opioid epidemic has raged on ever stronger. So the pandemic is exacerbating this situation. And here's a look at some of the CDC data. I linked this onto the course Moodle site, so you can actually play with this data and look at it in more detail. They show that percent change increase. You can see the graph there that's showing drug overdose deaths in the U.S. Rising and then rising ever higher now during the pandemic. The CDC has a lot of great graphs for all kinds of diseases and situations that break things down by state and even by county. So here we see that these increases are high across the country, right? So it wasn't like an isolated regional increase in overdose deaths. It was really happening nationwide. Some states hit harder than others. We see the highest change in Kentucky and West Virginia and some of the Appalachian areas, but certainly very, very widespread. So what's fueling all this, right? So what specifically with the COVID-19 pandemic has caused this, right? And so some big ideas out there. So certainly the increase in fear of the virus, stress related to the virus, caused folks to turn towards an increase in drug use. There was a lot of loss of income, loss of housing associated with the pandemic that again contributed to an increase in drug use. Treatment centers that were out there helping folks had to close temporarily. Some of them are still closed. And therefore folks lost access to behavioral therapies, to medication-assisted therapies because of the COVID pandemic. One of the big things some of those things kind of contributed to increased drug use. One that definitely can lead to an increase in deaths and overdose is that folks were more likely to be using drugs alone. due to social distancing and lockdown orders, folks were using their opioids alone, and thus there was no one there to call for EMTs to get the Narcan or whatever else to help folks if they were overdosing. And then a last major kind of shift with with COVID and lockdowns specifically is that the community health centers and state organizations that were helping folks with treatment plans, they had to shift their resources, right? There's only so many resources that the states have at their disposal. We talked previously this semester with like county health, kind of public health level initiatives. And so that money had to be pushed to COVID, and thus there was less money to support folks that had a substance use disorder. All right, other big issues that are associated with this same time, this spike during COVID, is the proliferation of synthetic opioids like fentanyl. So more and more of the deaths that we're seeing with these overdoses are related to fentanyl, more potent versions of these opioids. And then there's also been an increase in combination drugs. So where individuals are either knowingly or in many cases unknowingly taking laced drugs. So perhaps someone that is addicted to cocaine or methamphetamines, they are then given meth or cocaine that's laced with fentanyl. And so perhaps that individual has a tolerance built up to some of the other drugs, but they have no tolerance for fentanyl or the opioids that are laced in there. And so that leads to a higher likelihood of overdose in those individuals. So, this is a quick kind of summary, right? So we're seeing this big increase with COVID-19, some of these stressors that are going to be temporarily, hopefully, right, as the vaccine gets laid out and restrictions are lessened. However, the fentanyl and some of the synthetic drugs are not going away. And so I kind of wanted to end this kind of topic on a what can we do? What are next steps? And this is a nice resource for those of you that are going to be providers in the future, from the American Medical Association. And so I put the link there at the bottom. You can Google it by just opioids and AMA, American Medical Association. But really talking about how physicians, providers can play a large role in this, with emphasis on overdose prevention and treatment, learning more, teaching residents and medical students about safe opioid prescribing to reduce the number of prescriptions that are out there, how effective treatment works, right? The behavioral modification treatment that's combined with kind of like lowering dependence on opioids. All of these things have been shown to be effective in reducing opioid use and overdoses. So please check this out as well.